Hi, I'm Dr. Vinay Bharadwaj from Ensecure, and I wanted to talk to you a little bit about a book that I really love. When I was moving here a little over a decade ago, a professor of mine recommended that I read this book called The Indians, a Portrait of a People. It's by Sudhir and Katerina Gurkar. And, one of the things that I've noticed is that the average Indian thinks about, the different medical systems that we work with here, Ayurveda, homeopathy, allopathy, as it's called, very, very differently. And one of the observations from this book is that, when it comes to the prescribing of Western medicines or strong medicines, as it's called, uh, you know, the patient doesn't really feel like they've gotten their money's worth unless they come away with a prescription for a tablet or an injection. Really, an injection is preferable, or some other kind of strong medication or treatment. Like, you put them into an MRI machine, they'll be much more happy than if you talk to them. And I think this is an attitude that doctors, allopathic doctors, need to fight. I mean, when it comes to talking to your average allopathic doctor, advice is not enough. People are going to feel ripped off if all they got to do was talk to their doctor. Whereas Ayurveds and homeopaths get away with this stuff all the time. They get to actually have relationships with their patients and understand what's going on in their family and look for root causes. Whereas a doctor, an allopathic doctor, it's all about give me immediate relief. And I think that expectation hurts everyone. Doctors, Vaids, homeopaths, and patients alike. I think that we should normalize the idea that you can have an hour-long conversation with your family doctor, and maybe your family doctor may decide that you shouldn't be taking this medication, or that, instead maybe some changes to your lifestyle would be as valuable as a tablet. And I think it's a communication skills issue on the physician's part, but I also think that it's an expectation problem on the patient's part. And my hope is that I can give an hour-long talk on insulin resistance to one of my patients, and they find it useful, and they're armed with the knowledge of how to manage their diabetes a lot better than just saying take these pills and avoid sugar. I don't know. I'm just complaining. I get annoyed thinking about what's missing in when it comes to the treatment of Indian patients. And there's this one quote that I will try to get to you. In an average Indian village, a trained doctor would give a 2-year-old with a 3-day history of a cough and a vitamin B complex and gentamicin. And an untrained doctor would be throwing Augmentin at this kid, which you and I and any other physician out there will know that's a gross misuse of antibiotics. But there is an expectation to give these strong medications to that kid in that village. Otherwise, the parents won't ever bring that kid back to that doctor. So here we have this idea that, that actually starts from Ayurveda, talking about strong and hot and cold medicines. And we've brought that back. We've brought Western medicine into that fold instead of treating it as something completely different. And again, I think physicians of all stripes, doctors of all stripes, specialists, GPs, family doctors, all need to fight against this and spend more time with their patients and explain more to their patients, because it's not just the Ayurvedic doctor who can develop a relationship with a patient. It's not just the homeopath. Us doctors, us allopathic doctors, can do a lot and be there for families too. So, yeah, that's just me. I hope you found this interesting. Thank you. Bye.